Good afternoon, everyone, and thank you for joining us today. I would like to welcome you to FortneyScott's COVID-19 weekly briefing. These briefings are held every Monday and cover the latest topics and developments with regard to COVID-19 that impact the workplace. This briefing will be recorded. Everyone who registered today will be registered for all future briefings. These weekly briefings will continue as long as circumstances develop with regard to COVID-19. I want to address some preliminary items before we start today's briefing. Currently, all listeners' phone lines are muted. At any point in time during the presentation, please feel free to submit a question in the GoToWebinar question box. We will try to answer all questions. Today's weekly briefing addresses recent developments and returning to work under the federal guidelines. The presenters include David Fortney and Consuelo Pinto of FortneyScott, and Yolanda Hunter from Workplace HR, FortneyScott's Human Resources Consulting affiliate. I will now turn the program over to David Fortney to start our presentation.
Great, thank you, and good day, everyone. Monday, April 27th, and I think we, along with everyone else joining us today, continue working virtually from our respective home offices. Hope everyone is doing well and keeping safe. And we really appreciate you coming, most of you coming back, and some new ones joining this week for what is our weekly briefing on developments involving employers' response to the COVID pandemic. Joining today, I'm really pleased to have two folks joining, and they'll probably carry most of the load, I hope, and I'm sure they will. First, Consuelo Pinto, one of my partners at FortneyScott. Consuelo, do you want to say hello?
Morning, everybody, or good afternoon, depending on where you are.
Exactly. And our senior human resource consultant, Yolanda Hunter.
Hi, everybody.
Hi, Yolanda. It's great to see both of you, and looking forward to being with you soon. Just a word or two before we dive into the presentation. Just a word about our firm. I think, as most of you know, we are based in Washington, D.C. We happen to be a woman-owned firm. Our practice focuses on the workplace, and we do involve a lot with the federal agencies, and have been very closely involved in looking at the guidance and developments involving the federal agencies and what our clients are struggling with. Next slide, please. Also, a word about the presentation itself, if we jump into the next slide. The presentation, of course, is to provide you with the updates, information, not to provide legal advice, although many of the developments are legal in nature. We would strongly encourage that everyone on the call confer with either your in-house corporate counsel or your designated outside counsel to ensure that you receive legal advice that comports with your specific circumstances. So let me turn it over to Yolanda. And Yolanda, I'd like you to, let's start with the agenda on what we want to cover today.
Sure. Thanks, David. So as you all know, our team diligently monitors the latest updates on regs and acts as they're coming in related to COVID-19. So today we're going to discuss some of those recent developments as relates to new CARES Act funding, trends in COVID-19 related litigation, agency updates, and then we're going to talk about preparing for phase one of reopening. The president outlined a three-phase step, but we're going to focus upon phase one of that process. And then we will go into FAQs. So David, if you can start us off with talking about the new interim funding updates, please.
Sure, I'd be happy to. So one of the big news items, and this occurred the end of last week on Friday when the president signed the most recent congressional response to the COVID crisis, is the provision of $480 billion in additional funding. The majority of that funding is going into the Paycheck Protection Program, or the PPP, as I think everyone's probably become familiar with that acronym now. And that's of the 480, 320. Notice how we don't even say billion anymore, but you think about as taxpayers, these are huge amounts of money that we're talking about, are going for those small businesses in order. These are loans that can be forgiven for businesses with 500 or fewer employees. This time, within the 320, there is $60 billion that has been tagged or set aside for certain businesses, recognizing that many smaller businesses, particularly those in rural situations, minority-owned businesses, did not have established banking relationships. And there was quite a public brouhaha about a number of publicly traded companies that, although they met the actual metrics that were included in the original PPP funding, many felt should not have secured funding. So some of those companies have voluntarily returned. Interestingly, in this round, Congress gave a 2-week window for people that have secured loans to reconsider whether they really have met those requirements of hardship and unavailability of funding. And Secretary Mnuchin has emphasized that if you have alternative sources of funding, such as the ability to issue stock or other public lines of credit, for example, that it may not be appropriate and you may not qualify to receive this money. That, and along with some public jawboning, has resulted in a number of high-profile recipients with rather large amounts actually returning those amounts. So they'll be put back in the till, and as of today, there's a frantic rush to draw down the $320 billion. I expect it'll be exhausted in short order. Additionally, there was a reload of the loans and grants programs, again, as part of the Small Business Disaster Relief Fund. These are not amounts that are forgiven. These are amounts that will be repaid, but on fairly favorable terms. We have in the past covered in detail what the PPP program is about. Other than what I mentioned, there's no difference in the metrics that guide the PPP program. This is really just a reload of the monies that are available. Finally, responding to hospitals, particularly those that are finding funding shortages to provide PPE, particularly personal protective equipment, masks, gowns, other things such as that, as well as related funding for ventilators and other pandemic-related response, money set aside, as well as monies devoted for testing. So the part of the story is what was not included in this round, and there clearly will be yet a 5th round of legislation, it seems likely, although the content of that seems to be a little up in the air. But the question in this time was whether states should receive funding. A number of states, they tend to divide along blue versus red. Blue states are very tight on budgets, and states have a balanced budget requirement in contrast to the federal government, which, as we're demonstrating right now, does not have a balanced budget. And many states' fiscal years end mid-year, so the question of state funding, particularly as state income tax has been deferred for 60 to 90 days because of the pandemic, has become a major issue. So prediction, we are hearing there will be additional funding, I think, for the programs we see on the screen, as well as others. The real question, and it's a political question at this point, is whether there also will be funding for the states and how that impacts the timing of the additional funding. That being said, I think that in terms of the funding, the rest of the programs still though continue at full pace. So the funding is sort of the fuel in the engine, but let's talk a little bit, Consuela, maybe to you on what's going on in terms of potential employment claims and other developments.
Sure, thanks, David. So surprisingly, I don't know about many of you out there, but I personally thought for certain with the rushed closure of businesses and moving people to telework, others being required to still come in, layoffs, that we would have seen a significant uptick in employment claims in the last 6 weeks or so. That really hasn't happened, but I do think it's going to change. So what have we seen so far? Very early on, we saw claims by independent contractors, think specifically Lyft drivers, seeking to get employee status so that they can take advantage of state paid leave laws. We also saw some action in the OSHA area with employees, particularly on cruise ships, who were claiming they had not been provided sufficient safety equipment. From there, things sort of died down, but in the past week, there's really been an uptick in the wage and hour area. We have learned that Hair Cuttery, for example, was sued recently in Florida by employees for hours they had worked prior to the shutdown for which they had not been paid. In addition, related to that, just this morning, I saw some articles related to wage and hour receiving literally hundreds of calls from workers stating that they have not been paid for hours worked prior to the shutdown. Now, there's speculation that this group of employees are actually employees who were laid off, and these are employers who are suffering from, they've got a cash flow problem, and they're not able to make payments on that last paycheck. The other significant wage and hour update, I thought this was really informative. So on April 20th, wage and hour lifted its ban on enforcement of claims under the Paid Leave Act, the Emergency Paid Leave Act. 4 days later, wage and hour issued its first settlement of an Emergency Paid Leave Act claim. It involved Bear Creek Electric in Arizona, and it involved one employee who had been directed to stay home by his physician because he had been exposed to someone with COVID-19. And he requested paid time off under the Emergency Paid Leave Act, and that was denied by the employer. As a result of the settlement, Bear Creek is paying this particular employee $1,600 in unpaid sick leave. That's basically the roundup of the litigation that I've seen and I've been tracking. Really, I'm looking ahead to what's coming next. And obviously, and we're here today to talk about what's coming next, and that's the reopening of workplaces in stages throughout the country. And from there, I've really been thinking about, I think, some of the hot spots coming up, and I know Yolanda's going to cover some of this, and David, you as well, is workplace safety issues. There is potential for more wage and hour issues to crop up. I do think we'll start to see some employment discrimination claims possibly coming forward as a result of who and how employees are brought back into the workforce, to the extent that reasonable accommodations are needed, are those denied? I think another hot spot for those employers that unfortunately are undergoing layoffs and furloughs and may continue to do so, I think WARN Act violations are going to become a significant hotspot. So David, do you want to walk
folks? Let me just talk about the agencies?
Yes, please.
Okay, sure, be happy to. One of the things I was just thinking as Consuelo was going through what I think is, I agree, the tip of the iceberg on litigation claims. And one of the key battle points as we look at future legislation, I should have mentioned this in my earlier comments, is whether there will be any protections entered, any what the critics would call immunity or safe harbors given for employers that are trying to respond to the workplace. Because increasingly we're hearing from the business community that there is genuine concern as to litigation claims if they open, as they're starting to open, and people come back, that if people become ill or they don't do everything 100% perfectly, that they may face litigation claims that would be financially devastating. And if the COVID pandemic didn't wipe out the business, the litigation claims could. Now, to present the other side of that, those that bring the claim say, well, wait a minute, you shouldn't get a free pass. You need to do it right, and you shouldn't be insulated from those claims. Kind of a classic public policy argument, and it will, that and what happens to the states in terms of the funding, those are going to be two central issues in the next round of congressional considerations. But the agencies have been busy in the last week. EEOC issued some guidance under the ADA, and we're going to talk about this a little more, but the upshot is that we give you the website for the EEOC at the end of these slides, and it's on our website as well. But the EEOC has updated its guidance, noting that if you want to take temperature checks, and we're going to talk a good deal about this, that it does not violate the ADA, the Americans with Disabilities Act. Very helpful guidance. I would just note, and back on this litigation threat and enforcement that Consuelo was mentioning, I think we can count on the EEOC not pursuing ADA claims based on temperature check or based on the guidance, but that is not a legal safe harbor, and it does not preclude individuals, private parties, from bringing their own claims, or labor organizations, etc. So the agency guidance is helpful. Many employers, and we regularly rely on it to counsel people to follow a path forward. It's not a perfect legal safe harbor at this point. Wage hour continues to update its guidance. Again, its Q's and A's. A slight criticism to wage hour. It would be very helpful if you would annotate your Q's and A's and let us know which ones are updated. Those of us that are really trying to follow, we have to actually do a compare constantly. Every day we do a comparison to look at what's up there and what gets loaded. There is a revised question now dealing with the interplay of your paid time off, paid sick leave, and whether you can require your PTO to be drawn down and exhausted as you can under traditional FMLA. Candidly, the response isn't completely clear, but wage hours promulgated a lot of guidance, and that was their new guidance this week. OSHA. We're going to talk a lot today about OSHA. OSHA is continuing to issue guidance on industry-specific bases. Last week, it rolled out guidance targeted for the construction industry, and OSHA has a number of other guidances up there that are worth keeping abreast of. Finally, one that I think many people in the private sector have not perhaps thought about as much that we really want to just spend a moment on is the federal workforce. The federal workforce has hundreds of thousands of workers, and if you think about the variety of workplaces they deal with, laboratories, secure health settings, to office environment, to public facing, they're teleworking. They're doing much like the private sector that are all gathered on this call. The federal workforce looks a lot like that. The Office of Personnel Management, that's the federal government's, if you will, HR department, and the Office of Budget and Management, OMB, issued a joint memo. And again, we have it's about a 12, 14-page memo, very detailed, and it really talks about the incremental phases that the federal government is going to go through as it implements the federal guidelines, and we're going to be talking about the phase one specifically today. I just thought that federal workforce memo is a very useful tool, and I think it also is illustrative, at least at this stage of development, of a best practice that we in the private sector can look to. Obviously, it's very thoughtful, and I would point out there is a real difference between what you might be hearing at the weekly briefings by the president and some of the rhetoric that comes out on his Twitter account versus the substantive guidance that we are seeing both in this memo that we're talking about, the federal workforce memo, as well as CDC, the OSHA guidance, and others, as well as the federal guidelines that we talked about last week. But I thought that federal memo, and I would encourage everyone to look at it. We've got the link at the end of the deck for it. Consuelo, do you have anything else you want to add to that?
Yeah, there's a couple things. So, because we're here in DC, we tend to focus on federal agency updates. I just want to remind everyone who's listening that your state and local governments are going to control a lot of how you reopen. And so I would be paying very close attention to not only that guidance that's coming out, but also what sort of information is coming out of your state EEO offices, your state wage and hour agencies, your state OSHA, because their standards and where they are creating some space for you may be different than what we're seeing on the federal level.
And final thing on that, I just want to underscore, and many of the states are now recognizing even a more refined response dealing with larger population versus more rural areas, and it may be more county by county or other areas like that. It's going to be a very, for those that are multi-state, multi-jurisdiction employers, what we refer to typically as the patchwork quilt is going to have a lot of pieces in it.
Yeah.
And I think that's going to quickly, as a practical matter, become a big challenge as to how we develop a corporate response for each company that we can lay on top of that very diverse landscape of requirements and regulations.
Yeah. And just one other point on the OMB and OPM guidance. A lot of employers are thinking that they need to start up very quickly, and we're going to talk about how to do that, how to get started. But what I really appreciated in the OPM and OMB guidance is the very gradual and staggered return to work that it envisioned, particularly with respect to individuals that are part of the vulnerable population. They actually have a statement in there that you should have those employees continue to telework. Yolanda, did you have something?
I agree 100%. And I think that's something that when businesses do start to figure out how they bring the workers back and who they're going to bring back, those are areas that they need to pay specific attention to, those who are considered to be under that vulnerable population.
Great. Well, let's go to the next slide, and then let's move right in. So that's basically the update from the last week. And that's about 2 hours worth of material in a very short period of time. So if people do have follow-up questions, we'll be happy to deal with them. Let me just pick off one question that did come in. And reminder, those in virtual land, please send your questions in the chat box, and we'll try to pick them off and deal with them in real time. Question: should we expect more ADA claims from those who do not want to come back to the office? I'm going to hold that. Because I think the ADA is a big workhorse, and let's weave that question in as we talk a little bit about setting the stage and what now we're going to really move into. We've gone from developments into phase one, and we're using the federal guidelines as organizing here. We're assuming, we've talked about it last week in some detail. People are generally familiar with the federal guidelines, but it talks about an incremental resumption of work. Phase one is just that. Phase one. It's the initial lowest level return to work. And Consuelo, kick us off on this, please.
Sure. So these are, as the slide says, uncharted waters. I have not come across anyone yet who has experienced a return to work as a result of a pandemic of the size and expanse of the COVID-19. We don't have a lot out there that's concrete. We don't have any tested reopening plans we can look to. We don't have any regulations on the federal or the state level to help guide our decision making. We don't even have litigation that's arisen as a result of it to help guide us as to the do's and don'ts.
We're not complaining about that.
No, that's not a bad thing. But what is troubling is I think employers are accustomed to going down a path and at least having someone have gone before them, and they've got some guidance there. We don't really have much of that here. So uncharted waters, we're all in the same boat. We've heard a lot about the federal guidelines, the White House guidelines for reopening America. That is a great source for a very broad one-size-fits-all view of how to reopen your business. But one-size-fits-all isn't going to work here. So much of this plan that you're going to be working on depends on what industry are you in, what type of employees do you have, how many locations do you have, how spread out are they? The guidelines don't flesh any of that out for us. So keep in mind when you're turning back to those guidelines, it's just the very basis of a very broad plan. Remember, again, that whatever you do has to be informed by what's happening at your state and local level as well. It's really those agencies, those levels of government that are going to drive when you reopen and probably some of the parameters around how you reopen. So keeping a close eye on developments there is critically important. Remember, the plan for every workplace is going to be different. It really varies, as I mentioned, from industry to size to type of employees. But one thing I caution you about, your reopening plans are not something that you can pull together in a couple of days. Details matter here. You only get one chance at reopening your workforce. So we really need to drill down into the details. Think about, as an employee, how do you move through your workday? It's everything from what door do people come into? How are they going to open that door? And Yolanda's going to walk us through in some detail how to think about all of these different touch points and thinking about your workspace. Do you need to configure it? How do you reconfigure it? David mentioned the Johns Hopkins guidelines. I do think they're worth a review. David's going to talk about those some more and how you can weave those in. But David, right now I'm going to kick it back to you to give us a framework for how to start thinking about our reopening plan.
Great. So many labor and employment subject matter experts, human resource and other compliance professionals on this call, other than knowing how to spell OSHA, may know very little to nothing about OSHA, which is okay. But most of us in our day-to-day practice have thought about the occupational safety and health requirements as really predominantly focusing on manufacturing or other more, I'll call it industrial type of settings. So the first reminder, and we've talked about this again in our prior discussions, is that the OSH Act, the General Duty Clause, does apply to effectively all workplaces. And there are 28 states that have what are called state plans. So those states they have the option, and 28 states have opted to develop their own plans that have to be at least as effective as the federal OSH Act. So for this discussion, we're only going to talk about the federal act, but every state, if it's not subject to the federal act, has its own requirement. So to Consuela's point that each workplace, and notice she's not saying each company has it standardized. You have to think about this. It is a workplace-driven obligation. So many on this call have many different types of workplaces, ranging from manufacturing to potentially research facilities to your classic office facilities. You may have food service involved as part of that. So the ability of people to either work remotely or to work on site varies a great deal. In terms of what OSHA does, it helps us in organizing what the response is. And again, we have made reference in the past and would reiterate our recommendation that people spend a little bit of time getting familiar with an OSHA pamphlet that is designed for the COVID pandemic. We've provided the link to that at the end of this deck, so you'll have that with you today if you haven't already looked at it. But one of the excerpts is that OSHA does a nice job in very kind of layperson language. So again, I want to emphasize, you don't be intimidated by OSHA. You don't have to be a health and safety guru to benefit greatly from this. But OSHA, consistent with also how the CDC looks at it, recognizes that different workplaces have different risk levels in terms of the transmission of the virus. What is at the apex of this pyramid, the very high, as they describe it, are those jobs that necessarily put you in direct contact with, potentially with people and infection, and source of infection is the greatest. So people performing various medical, think about we talk about ventilators. Would have put someone on a ventilator, that requires a medical professional to have direct contact with a COVID positive individual and do a variety of procedures, invasive procedures on the individual. There are a variety of laboratory procedures where people are dealing with virus-contaminated materials, and obviously morgues and postmortems that occur on individuals that have passed. This is the very highest level, and as you would expect, at that end of the pyramid is where the greatest level of protections, and we'll talk about what those protections, the hierarchy of protections, need to be provided. Then as you work down, the next level, what is called high exposure, are jobs where you're likely to be exposed, where the potential is known and suspected. Think about those that are generally working in a hospital. You go into the emergency room area, et cetera, where not every patient may have COVID, but there's a high likelihood that you're going to interact. Again, the level of protections are very high there. Note, however, and I'll just take a healthcare facility as an exemplar potentially of all of these situations. Emergency room, high exposure, then you come to the medium exposure, where you don't know whether people are going to be infected. You may have a high level of population interface. So those hospitals that still have their general entranceway open, where people may want to come in and visit their friends or relatives that are patients, maybe in the cardiac or non-COVID related, but still the general public, interfacing with the general public. Think about retail. Think about a host of other situations that fall into this medium exposure risk. Note that most of these functions that we've identified so far, the concept of being able to do it virtually is almost impossible. This tends to require workers to be on site and to be involved with that type of exposure. So how we respond to that becomes very important when we start doing those functions. And then finally, what's referred to as the lower risk exposure. And this is where, frankly, the majority of jobs still fall into this category. This is your classic, think of it as so-called white collar or pink collar office work jobs, where most people, they can work in an office. You're not required to have contact with people that are known or to come in potentially within close contact of those people. And this is where we're going to talk about the controls and how they set up. What we thought did a nice job, and it kind of takes this pyramid concept and explains the level of protection. So in the very high is the greatest level of protections, whether it be PPE, barriers, engineering controls, et cetera, which we're going to talk about in a moment. And it cascades down so that the office setting, the lower risk category, is the one where you have the lowest risk and the lowest level of protocols that need to be introduced in order to sufficiently protect the workers. Comments are on those points, any, before we move on to some of the tricks in terms of compliance? No? Okay, let's go. Consuelo? I'm sorry, I want to pick up, we've got a comment. I just need the comment box wheeled up a little bit so I can see it. Thank you. Okay, this question, we are going to pick this up. We've had an ADA question. I'm just going to flag this question. You refer to the vulnerable population. Don't we run into age discrimination issues? Because the population refers to older workers, pregnant workers. We have age, we have ADA. How do you make sure we're not opening ourselves up to lawsuits when we're doing that? We're going to park that question. I note that. We are very worried about that too. So we're going to address that. But let's tie off on these OSHA standards, because I want to talk a little bit, Consuelo. So we've got the pyramid, we've got the protocols, the different levels of risk in different workplaces. Many employers have multiple risk depending on their particular workplace. What are you looking at in terms of how we comply with that?
Sure. So when you're thinking about the OSHA standards, you now have a sense of where your workplace falls in the pyramid. One element of OSHA compliance is to have an infectious disease preparedness and response plan. Now, from what I've read, the idea is to have that in advance of being in where we are right now, in the middle of a pandemic. But for those of us who haven't thought about the return to work, that's usually an element of your plan. So now we're going to focus on that one element of returning everyone back to work and creating a safe workplace in compliance with OSHA standards. And in part, we keep harping on the OSHA standards because, as we discussed earlier, there isn't a whole lot out there to help guide you. We have OSHA and we've got the CDC guidelines. And you're going to hear us, and particularly Yolanda, is going to be referring back to both of those documents over and over again. We have links on our website. There's links at the end of this presentation. If you don't have copies, these are two documents you should pull out and have handy, and everyone on your team developing your plan for reopening needs to be familiar with these. Because largely, one way to minimize risk of litigation is to harness your plan in some type of legal foundation. And these are the best sources that we have found as a starting point for grounding your plan. So as an initial step, you're going to think about your response plan. Think about sorry, I've lost my train of thought. So you need to identify prevention measures, procedures for identifying and isolating employees, and then a communication plan. In OSHA speak, with respect to prevention measures, they talk about administrative controls and engineering controls. And Yolanda's going to break those out for us and how to think about it. But as you're approaching this plan, there's a few things I'd keep in mind. Think about how and where your employees could be exposed to the virus in your workplace. So we'll talk about touch points. Your office setting. Do you have a break room? Do you have conference rooms? Things of that nature. Where can they be exposed? What steps can you take to mitigate those risks? And that's where your engineering and your administrative controls come in, is really narrowing down the chances for anyone to be exposed to the virus. Who do you need on your team? You're going to have a team that's composed of a number of different people. Some of them you may even turn to some outside experts to join your team to help you develop a robust and workable reopening plan for you. Think about how are you going to handle the situation when an employee gets sick at work. And it's not if, it's a when. That is just, it's a fact and it's going to happen. So you need to think about it and be prepared in advance. What's the plan if you have an outbreak in your workplace? How are you going to communicate to your employees all that you've done? Think back to one of our earlier slides where I said, we're in uncharted waters and details matter. Details really do matter here. You cannot address issues on the fly in this scenario. So it's really important to think through a typical workday and think about all the different issues that could come up. And that's what you want to address in your plan so that I hope none of it ever happens. But if it does, if that employee comes to you and they're sick, you know exactly what to do. You have people who are designated to handle it and they know what the steps are. So I'm going to kick it over to Yolanda because now she's going to really drill down and walk you through how to develop one of these plans and what you should be thinking about.
Can I just clear one question while get into this? There's a question we have whether businesses that have established OSHA plans should recalibrate based on the COVID-19 guidance. That's an easy one. The answer is 100% yes. 100% yes. So thank you for that question because we don't want you to rely on something that you had in place February 1 because what existed February 1 is not going to exist going forward. So Yolanda, why don't you help us understand that, please?
Okay, great. Thanks, David, and thanks, Consuela. And you're absolutely right. All of these guidelines that we're going to briefly discuss are aligned with OSHA and the OSHA guidelines. So let's look at engineering controls. By OSHA standards, that is basic infection prevention measures. What does that look like? We're going to start with the baseline. Before you can have your workers return to the workplace, you have to prepare the building. So what does that look like? If your building has been vacant for a long period of time, or let's say your office is in a suite and with a building that has been open and they've had essential workers in, it's still a very important measure to communicate with the building engineers, make sure that there is cleaning protocols in place, carpets are cleaned, floors are cleaned, check the HVA systems, make sure that there's clean air filtration coming through the offices, test the systems, run the systems, change the filters. You want to establish methods of making sure the workplace goes through a full deep clean and sanitation process. That is essential. In addition to that, let's look at the touch points. We spoke a little bit about touch points. It is very important to reduce your touch points. We have to start thinking about things that we never thought about before, like touching the light switch, touching the door handle. What does all that mean now? Well, now you have to think about, okay, how do we minimize that risk? How do we minimize that exposure? With supply rooms, supply cabinets, consider taking the doors off, making them easy for people to gain access for what they need without constantly having that touch point of the door handles or cabinet handles. Think about your bathrooms. Now, high touch point areas. Consider modifying into the sensor faucets, the censored soap dispensers, the censored paper towel dispensers. If you have a system where you have to manually touch the light every time you go into the bathroom, you may want to consider the motion detector lights that automatically come on once you step in. Very basic things, but very important things to think about for mitigating the risk and exposure. And then with regards to stepping up a very thorough cleaning schedule, that has to happen more than one time throughout the day. So what that looks like, you have to design that based upon your business operations and think about what is involved with stepping up that cleaning schedule. What is there going to be a cleaning team assigned to doing this? How maybe will you connect with the cleaning people of your building with regards to coming in and helping out with this process? And then let's look at personal protective equipment. And with that, if an employee wants to wear a mask, voluntarily wear a mask, they should be able to do so. However, it is also up to your organization if you decide if you want to put protocols in place or a process in place for individuals to wear a mask. But keep in mind, as we relate to the OSHA standards, some businesses, depending upon the operations, the job tasks, and geographic locations, are required to supply that PPE equipment. So you want to actually make sure you go by those OSHA guidelines and state and local guidelines to know exactly what type of PPE equipment you are to provide those workers as it relates to those requirements. In addition, continue to think about how you mitigate the risk and exposure. Have disposable hand sanitizer, wipes, and things easily accessible to your workers. In addition to that, consider maybe mounting on the walls those censored disposable Lysol sanitizers where there's easy accessible to workers. All those things may seem basic, but they're very, very important because it's going to help minimize the risk and exposure. Anything you guys like to add to that? David, Consuela?
Go ahead, David.
Okay, I was just going to say that some of these things, I really welcome Yolanda's kind of practical approach to this, and that's exactly what we're talking about. You literally would walk through the entire workplace thinking through everything. One of the challenges that some employers are finding is that some of the supplies, particularly some of the sanitizing supplies, are not readily available, or PPE, if you're going to provide that, is not readily available, which may impact both the timing or the response. So there may be actually staged responses as these materials become more available.
Right. Now, I just wanted to add, if you're a workplace where you're going to require PPE, this is an area where there are some ADA implications, and the EEOC has some FAQs on this point. You may need to provide an accommodation for employees, for individuals with disabilities. So think about someone who is hearing impaired and they rely on lip reading. Think about also from the standpoint of a religious accommodation. Some religious garb is not conducive to using certain types of PPE. So that's a detail you need to be thinking about if you're going to require PPE.
And I would say I would be cautious in only requiring that certain endangered employees wear PPE and others not, notwithstanding some of the EEOC guidance. I would not make those distinctions, both for concern under age, and I think everyone probably has heard the CDC guidance on risk factors age 65 and above, a variety of medical conditions, including asthma, pregnancy, diabetes, a number of other conditions that clearly, most of those clearly fall within the four corners of the ADA, or classic disabilities, either actual disabilities or regarded as disabilities. So caution still needs to be exercised in mapping out how you deal with that. Although we'll talk about the EEOC guidance in a moment. All right, well, let's talk a little bit more, Yolanda, about social distancing, because getting the physical plant kind of reset is helpful. Let's go to the next slide, please. Thank you.
So with social distancing, We're all becoming very quickly accustomed to social distancing. Now it's in the marketplaces, practically everywhere we go outside of the workplace. But now social distancing is going to be part of the new norm in the workplace. It's not going to go anywhere anytime soon. So what does that look like inside your workplace? Well, let's start with the receptionist area. The receptionist area is a very vulnerable area. It's a wide area in terms of a community hotspot where workers gather to talk, where your visitors come in, where your vendors come in. It's a huge potential hotspot place. So how do we minimize that risk of exposure? Well, you can consider a couple of things. One, using the partition glass with the receptionist desk, have the standing queues for the 6 feet social distancing for visitors and for vendors. Most of the time in receptionist areas, there's always a community phone. Remove the phone and also decrease the number of chairs that you may have in your receptionist area. Some offices have multiple receptionists sharing the same desk. What you want to be cognizant of that is potentially looking at staggering schedules and or shifts to minimize the risk, to allow for deep cleaning, provide those individuals with their own headsets, their own phone receivers, and also minimize the amount of potential clutter and things on those receptionist desks that they can be thoroughly cleaned on a continuous basis. As we think about the elevators, you may want to consider having standard stage queues for the elevators. You want to avoid overcrowding and ensuring that those places don't get overcrowded, and have a regular cleaning schedule for that to avoid those touch points as well, the constant touching of the buttons. When we think of the shared spaces, office traffic patterns, and open workspaces, this is where you really have to think about your office configurations and what you can do to allow for the 6 feet social distancing guidelines. So if you have some shared spaces where those desks and those open collaboration spaces are close together, then if you're not able to have the 6 feet pulling them apart, then put the partitions in between, those glass partitions in between to help. If you even have individuals that come in bringing their own laptops, think about having disposable mats that can go on their desk to allow for, again, minimizing risk of any type of exposure. Establish a one-way type of office traffic pattern because you want to decrease the density, and that's the key there. And that's part of the key of having the one-way traffic pattern within your offices. Open workspaces are going to have to be reconfigured. Again, to the best of what you're able to do with allowing the 6 feet social distancing and or putting partitions in place to allow for protection as well. With visitors, vendors, if you have employees coming from temporary agencies, it's very important to communicate what your guidelines are, what your protocols are, so they understand or are aware what the process is as well. Have plenty of hand sanitizers and wipes and things that are available to you, accessible not only to those individuals when they come into your workplace, but also to your workers as well. You want to limit your in-person interactions as much as possible. So we've talked briefly about return to work in phases and staggered shifts. Remember, this is really important, and you have to configure this according to the operations of your business. You have to really think about who's essential to come in and how will you bring those people in. And those individuals that can continue to telework, allow them to continue to maximize teleworking. You want to be able to do this in a manner where it's transparent and we're, again, top of the list, minimizing the risk, minimizing the exposure, allowing deep cleaning time to take place within the offices and on the workspaces as well. With fewer face-to-face meetings, I think we're all pretty much becoming accustomed to Zoom and WebEx and those measures. Continue those measures. They're very important. Do teleconferencing if possible. However, if there is a situation where guests absolutely have to come into your offices, minimize it to just 10 guests and set up your conference rooms with the amount of social distancing with the chairs, eliminate the unnecessary seating, even eliminate the potential conference room phones that are always potentially used. You're going to have to really think about those basic baseline things that can have potential risk and exposure. And finally, with your communication plan has to be very, very accurate. It has to be transparent. It has to be clear. Your communication plan to your workers has to outline what the protocols are, what your processes are, and what they can expect coming back into the workplace. You want to roll those plans out early, and you also want to give your workers an opportunity to ask questions. Because again, you have to understand there's still a lot of anxiety, they have a lot of concerns, and they are counting on their employers to put the right practical measures and steps in place that will allow them to feel safe and hopefully minimize the risk and exposure as they return to the workplace. And as you're putting these plans together, you want to train your employees on them, train them on what the new office traffic patterns are, how break rooms and kitchens are going to be handled, all of those things, what to do with regards to bathroom access, what to do with regards to elevator queues. All of those things matter, and all those things are very important because it aligns with how they're going to function throughout the day, throughout the workplace.
Excellent. I agree with every one of those, and it's a good beginning of what that type of list looks like. Well, let's jump into another key area on temperature checks and contact tracing. This is one that we've got a few minutes here still left, and I just want to take a minute or two on this. This is one, going back to that triangle that we talked about, and the very high and the high risk and down to the medium or lower risk office setting. This is one where there still is a little bit of ambiguity as to who and how temperature checks and contact tracing are going to occur. Clearly, the medical professionals recommend this. Both temperature checks, that is, as people come in the workplace, and contact tracing if you have a positive. The question is, to what end? The guidance, as it exists today, suggests that in those highest risk workplaces, these protocols definitely should be implemented. It's a little less than clear as you start working your way down the hierarchy to the lower medium level risk. The federal guidelines, the federal memo that we referenced before for the federal workforce also addresses this and cites it as a protocol that should be followed. We have a practical problem. The temperature checks, assuming that we can do them, and there are ways of doing them, but how they're being done, is the time compensable? What do we do with the results? And we recognize, I think everyone recognizes, a temperature is not a perfect predictor of whether a person is or is not suffering from COVID symptoms. It is a potential flag, but just one among many. So there are other issues being dealt with. But one thing that the EEOC has done in its guidance is it has at least said, according to the EEOC's guidance, we can conduct a temperature check, we can collect the information stored in the employee's medical file, and not run afoul of either the GINA, the Act Protecting Personal Medical Information, or the ADA, which is helpful. In terms of whether that time that is spent, if people are delayed in coming in, whether that's compensable, tougher call. As Consuela mentioned earlier, we don't have any cases on this in this context. We do, however, have cases in other workplace contexts where people had to go through preliminary activities, such as bag scanning, security checks, so forth. Think about when guards move into their prison work environment, or a variety of security checks that go through when people enter warehouses to go to their jobs and their delays, with airport scanning type devices. Generally, it's not perfect, but generally the federal case law has found that those are preliminary activities, do not have to be compensated. Note, however, state laws do vary on that a little bit. So this is a question, if you're going to engage in this type of conduct, which inevitably will lead to delay, you need to think about whether you do or don't have compensable time for your employees. Not to mention that people, if they're delayed, are maintaining appropriate 6-foot distancing between them as they're waiting to be tested and to collect this information. Consuela, do you have comments on this?
No, I think you covered everything.
Okay.
Yeah.
The contact tracing is really in terms of whether if you have a hot spot, if you have an employee that's positive or could potentially be positive, appropriate notification of coworkers, people in the workplace that they may have had contact. That's the employer's obligation. And increasingly there are local or state health obligations that may require you to report that information so that appropriate additional contact tracing can be done.
David, if I could just add one suggestion here. One thing that makes the contact tracing a lot easier is if it's possible to limit, depending on what kind of workplace you have, limiting your employees to where they need to be to do their job versus allowing them to travel all over the facility, up and down all the floors. If you know that John Doe has only been on level 2 of your facility, that's where you start when thinking about your contact tracing.
Very good point. Very good point. Okay. Well, let's drill down a little bit on the communication plan. Yolanda, next slide, please. Thank you.
Sure. And in the interest of time, I'll go through this a little quickly. Again, your communication plan is important. You want to have a cross-functional team that consists of human resources, operations and/or facilities individuals, and a legal team of advisors who can advise you on what you can and cannot do. But in addition to that, you want to also encourage your sick employees to stay home. And you want to build out policies and protocols around that so that they know who to call, who to contact in those particular instances. You want to definitely outline your changes in your operations and your workspace. They have to know what to expect. They're not returning back to what they left. It's going to be very different. Indicate what those safety and cleaning protocols are. Indicate how to report concerns and to who they report the concerns to. And in addition to that, employee wellness and their well-being is still at the very much of the forefront. You have to remember this entire pandemic has put workers and all of us basically into a bit of fear and anxiety. And some may have suffered some form of trauma from this. We don't know if they've had family members who have been affected or if they've been caring for someone. So your employee assistance programs is extremely important during this time period, and it's going to continue to be needed. So when you have people come back into the workplace, even prior, and part of your communication plan, provide them with the telephone numbers to those counselors of who they can talk to help prepare them to come back in. And then once again, read about the compliance with the OSHA and CDC guidelines. Make sure whatever you're doing as you're putting as we discussed, these basic preventive infection measures in place, whatever you do, make sure you are going by the OSHA and CDC guidelines. In addition to that, adhere to your state and local guidelines. When you're looking at your buildings, make sure that you are in compliance with the security guidelines of the building, with any safety codes of the building. You don't want to compromise or put anyone at risk in trying to hope and prevent risk and exposure.
Only thing I'd add to that, and then we'll take one FAQ. We've got several, but I think we've got time for one. Is that the guidance both by OSHA, CDC, and the states is continuing to be updated constantly. So these communication plans and all the related plans we view as living documents and are under constant review and updating as appropriate. So let's go to the next slide, please. Consuelo, I'm gonna take the last minute or so we've got together, because all this planning that we're going to is trying to minimize the chance. But what if, notwithstanding we've done everything by the book, we have a recurrence? What steps should be taken if we have an outbreak after reopening, which is the nightmare scenario that we're trying to avoid?
Yeah. No, and this is something everyone needs to be thinking about. I feel like I've said this a lot today. There's no easy answer. There's no resource to go to. There's no how to. I think, thinking through this, I would, first of all, don't assume that an outbreak means you need to shut your whole facility down. I would think about, and think about this on the front end in your plan. As Yolanda talked about, there's things, there's a suggestion that, employees, if they're sick, stay home. How are you going to tell them that? This is no different. You're going to build into this, into your plan, what am I going to do if there's an outbreak? I think of it as contact tracing in a way. Who is infected? How many are infected? Is there anything common about them? Are they all on the same floor? Again, going back to my earlier suggestion, kind of trying to restrict people's movement. Are they all on the same floor, or do they all work the same shift? And then think about how to strategically, unfortunately, close down certain sections of your workplace. But I'd also think about in advance, what's an outbreak in your definition? Is it one person, 2 people, 100 people? I mean, there's a whole range there. And Yolanda, you may have something you want to add to that.
I do. And while we're thinking about this, you want to think in advance about your remote work policies, your telecommuting policies, your PTO policies. What are going to be your protocols, and what are going to be your processes, and how are you going to manage those things? Because, again, we've seen with where we currently are now, everyone is pretty much remote working. And so everyone is now trying to figure all this out and put it all together. But again, going back to Consuela's point and thinking in advance, this is the time to get those policies and processes in place and get them out to your workers and train your workers so they know what they need to do. Look at your technology, look at your data security. All of those things are important for when this happens again, then you can be better prepared and know how to execute.
Okay. Thank you, Yolanda. That will be the final word. Our time has run for this week. Next week on Monday, May 4th, we will be doing another of the weekly briefings on the developments in between, and we really are looking forward to seeing everyone then. So I'd like to thank both Consuela, Yolanda. Thank you very much for today.
Thank you.
Thank you.
We would like to thank you for joining us today. As a reminder, you may view the previous weekly briefings on our website at www.FortneyScott.com. Please join our next weekly briefing on Monday, May 4th. Be on the lookout for additional updates, which will be sent via email. All registrants from today have been registered for future weekly briefings. If you have any questions that you'd like to have addressed during the next weekly briefing, please submit via email to info@FortneyScott.com. Thank you, and we hope to see you next week.
Thank you. Have a great day, everybody.
Thank you. Yay.